Hi, I'm Shelby Dickison, OBGYN at Washington University, here to talk to you a little bit about COVID-19 and pregnancy. Pregnancy at baseline is associated with a lot of anxiousness regarding the new baby. And right now, I thought we'd talk just a little bit to help calm those anxiety or calm those nerves in this new pandemic. So, pregnancy normally is associated with an increased risk of the mom getting sick with any respiratory infections, such as influenza or the flu, which is a perfect example. But during the COVID-19 outbreak, we're not seeing any worse maternal outcomes, but everything is changing very quickly, and we're monitoring the status of our pregnant moms, both during pregnancy and then also after, to see how the virus is affecting you. There might be a risk of preterm delivery associated with COVID-19, but once again, it's just preliminary data. We do know that in order to help prevent spread of the infection, we do recommend that all pregnant women follow CDC guidelines in wearing a mask in public, washing their hands both before placing the mask and also taking it off, but then also maintaining social distancing with staying greater than 6 feet from other individuals. Because of these constraints, you may notice that your doctor might change your pregnancy follow-up interval. You might be doing telehealth visits, you might be doing phone visits, and you might also notice a shorter stay if you have an uncomplicated delivery after delivery. In moms who do test positive for COVID-19 during delivery, we have a new policy at Barnes-Jewish Hospital that the mom and baby, as long as everybody is healthy, will stay in the room together. And we will try to maintain as much social isolation or distance as possible while being in the same room so you can still see your baby. We do still encourage breastfeeding, and so we can help you do that during this time period, because breast milk is very important for you, but then also for your baby as well. Routine obstetrics hasn't changed because of COVID-19. We still will do skin to skin if it's appropriate, delayed cord clamping, and operative delivery only if medically necessary. And we don't recommend a C-section just because of COVID-19, although you might have other indications for that. Now, it is good to know that with COVID-19, we are seeing individuals who have higher risk conditions such as diabetes, hypertension, who are getting more sick than the general population. If you are pregnant and you have another medical complication such as those, it might put you at a higher risk if you did get COVID-19. So it's important to keep that in mind. COVID-19 testing currently is not recommended for everybody. It is only recommended if you have symptoms. And recently, the FDA has approved antibody screening. So antibody screening is looking to see if you have proteins that have been exposed to the virus. We don't know if you do have antibodies, if they will prevent you from getting it in the future. And we also don't know how well the tests can pick it up accurately. So we aren't currently screening all pregnant women for antibodies in addition to the viral testing. Now, unless it changes your medical care, you might be asked for those tests. Our visitor policy at Barnes-Jewish Hospital remains for Parkview Tower as well. You have one visitor during your hospitalization. If you have another support person that you want to be involved with your delivery, we have done Zoom or FaceTime, whatever is good for you and that person to work together with. We will support you in that endeavor. If you do have a visitor come with you into the hospital, they will be screened just as you. They will be required to wear a mask, and they won't be able to leave while they're with you in the hospital. We have a tent outside of Parkview Tower that we are screening individuals as they come in to ensure that if anybody has a concern for COVID-19, that we're able to put them in a special place so that the virus isn't spread to everyone in that in the tent. And lastly, I just want to emphasize that we are currently allowing COVID-19 moms to be in the room with their baby, but understand as clinical conditions change, our policies are changing to adapt to them as well. So hang in there. We will do this together. We will take care of you. And if you have any questions, I encourage you to call your OBGYN.